I'm Marv Curtis, and I'll be your presenter. When we experience pain, it could happen any place at any time. It frequently catches us by surprise. And sometimes it's difficult to know what the problem is, how it was caused. There's a big caveat when we start. When we do this kind of an approach, we need to make sure that we are not acting as a substitute for good medical care. So as we talk about how pain works, it's important to understand that what happens in your body where you're experiencing the pain and what happens in your brain where the signal gets to send that message of pain, there are what we call neural pathways. This is that passageway in which the message goes from one place to the other and says, something went wrong, this is a cause for pain. The reason this is important to understand is that each of the messages that are transmitted through this pathway are encoded with many different variables. And in today's discussion, we're going to talk about what we call submodalities. These are some of those variables that encode the pain message. Let me give you an example of some of these modalities. I recently had a call from a patient who was in her first trimester of pregnancy. She was so ill, she was in fetal position on her couch, could barely hold the phone to her ear, and was in so much pain she was weeping most of the day. She'd had a PICC line in because she was vomiting, she'd lost a lot of weight, and was in real dire straits. What I simply did was, over the telephone, I asked her to point to where she experienced the pain. Well, of course, it was right here. It wasn't really pain, it was the sense of nausea, the feeling that she had to throw up. Location is a submodality. So when I had her point to it, that was the first variable that I wanted to deal with. Where is that? It's also a form of distraction as well. We're now thinking about a location. And then I said, what color is it? And she said, it's kind of gray. Well, there's another submodality, color. And I said, okay, I want you to do something for me. I want you to move all of that gray from the inside of your stomach and have it rest just on the outside of your stomach. And she said, oh, okay. 15 or 20 seconds went by and she said, okay, I've done it. And I was impressed because she was really, really in a lot of distress. Then I said, the next thing I'd like you to do is I want you to change the shape of that gray mass into a very small ball, still just resting on your abdomen. So size is another submodality. So we went through that process. She was able to reduce it to the size of a ball. Then I said, I want you to imagine in your mind's eye that that ball is spinning in a certain direction. Well, rotation is another submodality. So she determined that it was spinning a certain direction. And I said, okay, now we're going to do something different. I'm going to ask you to reduce that ball to the size of a pea. And at the same time, I want you to reverse the direction that it's spinning, and at the same time I want you to change the color from gray to white. I said, this is going to be a little complicated. I'm asking you to do 3 things at the same time. Take your time and let me know when you've done it. Well, it wasn't very long before she had reduced it to the size of a pea, she'd reversed the direction that it was spinning, and she'd changed it from gray to white. And then I said, now what I want you to do, I want you to imagine that it is resting on the fingernail of your pinky on your right hand. Well, she'd done a lot of hard work up until now, and it wasn't long before that pea-sized white light was resting on her pinky. And then I said, now I want you to just imagine that it's been absorbed into the tip of your little finger. And she did. This whole process took us about 10 minutes. And then I said, how are you feeling? Go and check in right here where that gray mass used to be and tell me how that feels. Look for that nausea and notice that you can no longer find it. And she did. She put her hands right there and went, wow, it's no longer there. I can't feel anything. And she got right up, she walked around and she said, can I eat something? Of course, we both laughed. That's exactly how this works. It's that simple and it's that fast. Now, in chronic cases, it may only last an hour. It may last a day. It may last her whole life. It depends on whatever else is going on. And we went on to do a lot of other work that needed to be done to help her through some of the depression and issues that she experienced. But the point of this is to say, by simply changing how the brain encodes and receives pain messages, By changing those submodalities, it no longer got that pain or discomfort signal.